And a BBC London investigation has found some London hospitals are writing off more than 90% of what they're owed for treating foreign patients. All hospitals are required to chase up money owed when they treat those from around the world who do not qualify for NHS care. Mercedes Abalando lives in South London and did not qualify for free NHS treatment. She's told BBC London that she was an illegal migrant when she was treated at King's College Hospital last year.
I went to the hospital and I told them that I didn't have that kind of money and I couldn't pay. The person that saw me at the hospital said to me, well, that's fine, no problem, took the letter and I've never heard from them since.
Mercedes went on to say that she couldn't pay the bill. King's College Hospital said it wrote off £343,000 for the treatment of foreign patients last year. Fizza Quereshi is from Project London, who help vulnerable people gain access to NHS services, and joins us now. Fizza, good morning.
Good morning. Thank you for inviting me onto the programme.
So, who are we talking about? Who do you help?
We help individuals, any individual who is having difficulty accessing healthcare. The majority are individuals from a migrant background, but there are a range within that kind of migrant background. So you have people from the EEA to people who are undocumented. But as even last week, we saw a British citizen who wasn't able to access healthcare.
Now, understandably, you're keen to see access for all, but there are many people who would say, if you're not a taxpayer, why should everyone else pay for this? Why should everybody else pay the bill?
I think it's difficult. I think you should be looking at the medical need of an individual rather than whether someone has contributed to the tax system. There are lots of individuals who are British citizens who aren't contributing to the tax system, so it's quite difficult to use that as an argument. And the NHS has always not been seen as a public fund in that sense. It would be restricted to other individuals.
Now, the NHS, of course, has finite resources. Hard decisions are being made already. Is this something you think that will get worse for people from abroad who don't qualify for NHS treatment? I suppose I'm asking, will we end up with a sort of American system where, by and large, you're asked for a credit card or insurance certificate before they'll even look at you?
It's very possible. There was a review that was undertaken last year where they were thinking about introducing health insurance for individuals who come to the UK. I think the problem is that when someone doesn't have insurance or is unable to pay, they're going to end up accessing emergency services, which cost, I think, 3 times more than primary care access or GP access.
Thank you for joining us this morning. Fizza Quereshi there from Project London, which helps vulnerable people gain access to NHS services.